Hi, everyone. Thanks so much for joining us. We're going to start in about 30 seconds. So looking forward to it and seeing a few. Hi, everyone. Thank you so much for joining us on this Wednesday. My name is Chris Hanley, and I serve as the Director of the Grand Challenge on Climate Change, Human Health, and Equity here at the National Academy of Medicine. And today we are so thrilled that you're all joining us as we are looking to get your input on a potential deliverable or product that we are looking to create over the next several months. Next slide, please, Camilla. So a quick speaker introduction / quasi agenda. I will be framing this project a little bit within the larger program of the Grand Challenge. And then from there, I'm going to turn it over to our wonderful, wonderful co-chairs, Jonay and Teddy, who are going to walk through the product in a little more detail and kind of talk to you a little bit about how we came to be here today. And then lastly, I will turn it over to Megan, who will walk us through what this deliverable might end up looking like. And we'll, at that point, be looking to get some of your input through a program that we'll be using called Mentimeter. And we will finish off this session with a general Q&A for all the panelists. You should see on your screen, you have a Q&A option. You're welcome to input those questions at any time. We won't be taking them until the end, but they'll be stored nice and safe for us to bring back up at the end. Next slide, please, Camilla. So a quick program background before I turn it over into a project background with Jonay and Teddy. Next slide, please. So launched in 2020, the Grand Challenge on Climate Change, Human Health, and Equity was kicked off to improve and protect human health, well-being, and equity by working to transform systems that both contribute to and are impacted by climate change. And you can see here on the screen listed in front of you our strategic objectives. I won't go through each of those individually, but what is important for you to note is that on the next slide, you can see that they currently map to our 5 programmatic pillars, which as of right now makes up our Grand Challenge as a whole. And as you might have guessed, we're going to be focusing on the communications and messaging pillar for this session. But if you're interested at any time in finding out more information about the Grand Challenge as a whole, you are free to visit our website where you can find all of the details that you should need. There's probably a link in the chat put in right now, but if you ever want to find it, just feel free to Google NAM and climate change, and it should be the first link that pops up. Next slide, please. So that was a quick overview of the program, and now I'll do an even quicker overview of this project and really what we're trying to achieve with it. And as you can see on the screen, it's quite simple, not easy, but simple. What we're really looking to do is to produce a set of materials that, one, summarize in plain language the impacts of climate change on health, and then secondly, to support health professionals and other health communicators in sharing this information with your audiences, which is the majority of what brings you all here today to share with us. And on the next slide, I'm going to turn it over to Jonay, who will continue this conversation.
Thank you. Thank you so much, Chris. And thank you to everyone for joining us today to offer your very important feedback on this project. As Chris mentioned, specifically, the project is aimed at helping to empower health professionals to help people mitigate the effects of climate change and adapt to it. This work is incredibly important, as I know many of you know. And of course, the statistics are certainly alarming. There's many stats out there about the impact of climate change and specifically the impact on health. But one that is particularly alarming for me is that an estimated 21 million additional deaths attributed to climate change in the world will be here by 2050. So this is incredibly important. I'd also say For me, I'm a ER doctor. I'm a former state and local public health official. I'm a mom. This really hits home. I've seen so many of us have stories. I know I've seen in my practice too many patients in the ER suffering from the effects of extreme heat. We see people suffering from cardiovascular and pulmonary illnesses due to air pollution. Led many public health crisis responses and outbreaks due to vector-borne diseases and illnesses. And we're seeing more and more the impacts on people from things like flooding. And I would say that's what's most alarming, not surprising, but alarming, is that while everyone on Earth is impacted by climate change, it's really the people who have already been made the most vulnerable. So those with underlying medical conditions, pregnant people, infants, children, people who are already living in poverty, who are really the most impacted. So this work is incredibly important, and especially as we take that lens, as Chris mentioned, of equity in our approach. But I'll say, I'm not all doom and gloom. And what really keeps me motivated is that climate change is not inevitable. And there are very specific things that we can all do to slow climate change and also to ensure that our communities are really able to adapt effectively. And that's why the work of this committee, this project that we'll be talking about today is so important. We really have to make sure that we have the tools and the information that we need to save ourselves and to save our planet. So really, really important project. It's been an honor, certainly, to work on it with this committee that you see here on the slide. Of course, again, the committee members that you can see, just so incredibly impressive backgrounds. Of course, I have to thank my co-chair, Teddy, but also Chris and Megan, who you'll meet shortly, for their incredible work here and the partnership. I'll also say it's been really, really important as we were thinking about how to engage and how to really develop a product that was helpful, that we be really inclusive in the process. So you'll see in the range of people that we have on the committee from diverse backgrounds, that was really important and a focus of this project. People with different backgrounds, different expertise, different lived experience as well, just so important. And also part of why we're having this webinar today is we really, really want to have as much feedback as possible so that this is really a useful tool for all of you. So really excited about this process, this product, and really looking forward to hearing your candid feedback today. With that, I think I'll turn it over to my co-chair, Teddy.
Great, thank you. When I first started my climate advocacy in the early 2000s, the Earth's atmosphere was still below 350 parts per million CO2. So our actions focused on urgent mitigation. We hadn't started seeing global disasters or mounting health issues. But as a public health nurse, I knew these were not far behind. Now our parts per million is about 425 as of this May and continuing to be on the rise. And times are different. The World Health Organization states that climate change is happening now and its impacts are being felt around the globe. WHO estimates that 1 in 4 deaths can be attributed to preventable environmental causes, and climate change is exacerbating these risks. Again, I stress preventable. As a nurse, I know that the time for debate is over. We must work for mitigation and disseminate science-based adaptation and resilience information as quickly as possible to as many people as possible. And that's why we're here today. So how did we do this? Our first strategy, as you saw, was to gather as wide a group as possible. And I think the organizers of the project were probably surprised by Joanne and I, who kept saying, who's missing from the table? Somebody's not here. We have to find the person representing this geographic area or this group of people or this impacted group of people. And we kept digging until we found a representative committee. Then we met as one large group and we divided into communications working group and a science working group. We did find that there was quite a bit of overlap in these two groups. So much so that some of the members said they don't want to be part of just one working group. They wanted to be part of both working groups, which really shows you the commitment and the importance of this work. In the past, a project like this would have started with a preconceived idea and forced the data and the views of the community to fit that plan. This project instead started with a robust needs assessment that included a literature scan to determine if and where gaps existed. Our committee members recommended hundreds of resources, including research articles, reports, toolkits, and advocacy organizations. Even though our list is not comprehensive or exhaustive, it became evident that there's plenty of information available for health professionals, patients, and communities and policymakers. When we did a deeper dive into the needs of 3 specific target audiences, these were health clinicians, public health experts, and community members and especially focusing on communities whose health is most heavily impacted by climate change. That brings us to today. The assessment indicated we do not need more literature. We need some process or method for people from various groups or in various roles to access the most appropriate literature to answer their questions. Through this webinar, surveys, and emails, we hope to refine what we are launching today as the Climate and Health Resource Hub. It still might have a different name, and that's the work we're at, but we want you to see what this ideal will look like. And Jonae, back to you.
Thank you. Thank you so much, Teddy. So, next slide. So the focus for this project, as Teddy alluded to, really was to look at the current science and evidence, and there's plenty of it around what people can do to protect themselves from the impact of climate change. And importantly, we're very grounded in the science of climate communication. Again, there are experts in this field. Some of them are on our committee, really making sure we're getting at best practice for sharing this information with diverse communities and really empowering that action. The audience for this, the primary audience, really are healthcare professionals. I mean, we do mean that very broadly. So that's including, but not limited to, public health professionals, community health workers, nurses, mental health providers, physicians. Again, that's not an exhaustive list. Our secondary audience really including the broader community, first responders, people working in government, parents, patients, et cetera. So really broad, but especially with this focus on that public health or healthcare kind of interaction, and knowing that oftentimes that's an opportune time for someone to hear this information from a trusted member of the community. So that was really the focus and the audience for this project. And Teddy, I'll let you talk about the process and sustainability.
Great. So we want to make sure that NAM's standard of excellence is maintained. The National Academies has a wonderful reputation, and people trust the National Academies to provide excellent, well-vetted information. And so that's how we chose the resources that we recommend. They must be evidence-based. They must be related to human health. They have to be open access. They can't just be available to some people. They can't be require a paywall or overcoming a paywall. They must be available, and they must be applicable to a wide audience. Now, right about now, you might be thinking to yourself, who's going to maintain this site if we get it up and running? And that was our question, and we have the assurance of the National Academies that this hub, this resource hub, will live underneath the Grand Challenge initiative, and it will be refreshed every 1 to 2 years with updated information. So now you'll hear from Megan Snare, our exceptional project manager, who's going to describe the web resource tool. This will be followed by time for feedback and questions and your response via the Mentimeter. We really do want to hear from you. The hub is a beta test, so don't get too into the weeds of it being not specifically set, or you would add additional pieces. We want to know about the concept of the idea and how the maneuverability works. So the hub will only be valuable if it is used. You are part of this great co-design. Megan, back to you.
Thank you, Teddy. Next slide. Okay, so I just want to kind of frame where we are. First of all, thank you to all of you who have joined. If you are here, you probably care deeply about this topic and know the lay of the land quite well. So we're really excited just to have your participation and willingness to share your thoughts and opinions. So I'm going to walk through our prototype in a minute, but wanted to just give you a heads up. I'll walk through each screen first, and then we'll switch screens to a Mentimeter slide deck. If you've never used that before, it's just one of those live participation opportunities platforms. So you can type in and send us your answers from your phone. These are some of the questions that we will be doing today. But there's also, Camilla, can you go to the next slide? So if you're busy today, or if you're driving, or whatever it is, we still want to hear from you. So we have future opportunities for your feedback as well. You can scan this QR code to the right, and that'll take you right to a survey that asks the same questions. Or if you have a lot of thoughts and you don't want to feel restrained by our 5 targeted questions, we still want to hear from you. So please, you can email your thoughts to climateandhealth@nas.edu. So with that, I think we'll switch screen sharing. And I will get started with the prototype. So again, this is just our very initial design. We're looking for all of your feedback and thoughts. But there will be some type of landing page, homepage, explaining, extreme weather events, all the consequences of climate change that people are starting to see more and more every day. Some kind of initial language that anchors the user in what they're about to experience, why they're here, why this is important. And then you click the Start Exploring button. And it takes you to this, what's your primary role in health or caregiving? These gray boxes on the side are just for the demonstration. They won't be in the actual tool. And so right now we have these several different personas, user personas, that the user can decide which one they identify the most with. There's likely a lot of overlap, but for just usability, we're thinking of kind of one pathway. And then you could go back and choose a different pathway if you're wearing a different hat that day. But these are some of the different archetypes that we came up with. For today's purposes, we're just going to choose a health professional. So you would click, you would click on this card and then go down here to next. And that would bring you to this next screen, which is, what action do you want to take today? So are you here to learn ways to keep your own self healthy, just to educate yourself more? Are you someone that's in a position to be educating or giving advice to other people, and you want to just feel more knowledgeable about that? Are you teaching other health professionals best practices, or are you really looking to create change in society? So what are things that you can do to do that and feel more empowered in doing that? And so again, today we're going to give advice to others. And as you can see, if you kind of change your mind, or you just want to go back and pick a different one, this back button up here will take you back to the previous screen. But then we'll click next. And if you're impatient and you don't want to answer all these questions, you just want to get to the resources, you can just also come down here and skip all the questions and just take me where I'm going. How do you like to get new information? So when we were going through all of the various resources, that exist, and as Teddy pointed out, there's just a wealth of information on this topic, and from all different angles, from all different sources, points of view, ways of consuming information. And so as we're trying to narrow this, allowing the user to get kind of a customized, relevant set of resources, there's podcasts, there's YouTube videos, there's different people sharing things on social media, and there's all kinds of things to read. So this is just another way to narrow it, filter it a little bit. So today we're going to click reading. And then finally, there's, all of you know very well, there's different hazards that can be associated with different regions of the United States. Sometimes it might be because you live there or because you have family there. So just to really make it more customized, we ask you to choose the region that you are most interested in. Today we're clicking the Midwest. And then the last step is see resources. And so this is the final screen, so your final landing place. And again, this is just our first iteration, so we're really looking for your feedback. But what we're thinking is that this would give you the top 5 resources based on how you answered the questions. We would select from this massive database that we have and give you the top 5 resources as a starting place. Again, this is not comprehensive. It's not meant to be like an exhaustive listing of things that you need, but really just if you're kind of new to the space or you just want to feel more comfortable either teaching others about the linkages between climate change and health, or whatever the case may be, we just want to give you a starting place that's not overwhelming, or that doesn't feel as overwhelming as just Googling climate change and health, which can be quite overwhelming in itself. So here you'll see thumbnails of each of the products, who their creator is, when they were released, and then these buttons will tell you, English, Spanish, whether it's a toolkit or a playbook or a website or a podcast. And we can even do listening time, so you kind of know what you're getting into before you dive in. But in addition, I should also come up here. If you decide you want to change things up a bit, or you're like, oh, actually, I don't have time to read anything today, but I could listen to something on my way to work. Instead of going back through and doing the whole filter set of questions again, you can just come up here, and not that one, and click these as a drop down, and you can choose any of the other options. The screen is a little funky still because, again, it's a prototype, but so you could change the option here and it would give you a different set of resources. So in addition to this kind of, customized curation, we also wanted to add something on top of it. So this is also a main question that we have for you today, is what else would be useful here? Like, what are you looking for in this work? So here's some great resources that have already been created by other organizations, but what else can we add on top of it that would add value? So we were thinking, potentially sample messaging. So maybe just some quick kind of one-line tweet length messages that you could copy and paste and use in quick work. We were talking about putting more detailed takeaways. So, perhaps for every one of these user personas, health professional, mental health, community leader, perhaps each one we could go through and summarize the relevant resources to that user, and then give you, you'd be able to download a 1 page is probably too idealistic, but just a 2 to 3 page brief summarizing all of the resources for that user pathway. Or we could, this is where we could really use your ideas. So what would be useful? Is it, op-ed templates or toolkits for holding town hall meetings, or, having a policy salon, depending on what your area of work is or what organization. Maybe it's you want to bring a group together and have these discussions. Like, could we help facilitate that somehow? And then our final message for the user before they leave the site is we want to educate and we want to give you these resources, but we also really want you to feel empowered to take some type of action. And so we're, again, still thinking about what actions those would be. But one of them we thought could be, depending on which which region you select on the map, we can list some of the relevant and active networks or associations. So for, we click the Midwest, join up with health professionals for a healthy climate, which is based in Minneapolis. Hopefully that's somewhere in the relevant region of where you're living or where you're working. You can click on that. We could have an ongoing list of others. We could also put some of the basic actions that are recommended in a lot of these reports, ways to reduce your impact, or driving less, walking more, some of these interventions that have a lot of co-benefits for health and the planet. But this is really kind of where we're open to ideas, and we want to make this as valuable as possible. So I will stop my share right there and now switch gears to getting some feedback from you. So if you can see on the screen, if you are near a computer or a phone and go to menti.com, it'll ask you for a code. You can type in this code and then it should take you right to this presentation where you can type in your answers. All right. So with this question, short-term and long-term steps to protect your health. In reviewing a lot of the literature and the resources, a lot of the actions that were recommended were actually more focused on really long-term, driving less, shifting to a more plant-based diet, things like green roofs and reducing the heat island effect, a lot of things that you could put into place today, but you might not see the effects on your health for years to come. And so there weren't as many short-term acute health tips, like, if it's a bad air pollution day, you should wear a mask when you go outside, or you should, here's different types of air filtration systems that you can put in your home. And those, we were expecting to see more of those, since they're more kind of short-term and focused on how to protect your health today. But it was just interesting, there weren't as many, so they were more long-term. So, again, so we can make this as useful as possible, this tool, want to make sure we understand what you are looking for. And so we have a lot of votes for both. So I think that gives us some good content and helps with our direction. So thank you for those answers. The next one, we had this discussion quite a bit within the committee. Different states may not use the term climate change, and we were trying to figure out what the best way might be to be able to share the right information and show these linkages without overstepping or without causing other challenges that may be unintended. So I've made this a word cloud situation. So any suggestions you have on words to use if there's certain states that don't like the idea of climate change being in documents? So just watching some of these come in. Sustainability and extreme weather seem to be some big ones. Climate resilience. That's interesting. And I see a lot of questions coming in also. Thank you for those. We'll get to those shortly in the next portion. Climate resilience, planetary health, natural disasters seems to always speak to people. Interesting. These are really great. Thank you all so much for participating. Okay.
Megan, we had a little issue with the code, so maybe we can just give people another 30 seconds on this slide, as some
sure.
people are just jumping in now to add their input.
Okay. We've got 48 responses so far, which is amazing.
Just so people know, if you don't have access to Mentimeter, we still will want your answers. And so Megan's going to be describing at the end other ways that you can participate and other ways that you can share ideas with us. So it's not a wasted effort. We want all the ideas that you have, even if you're not able to join this way.
Okay. Just do another 30 seconds or so. Okay. I think they have slowed. So these extreme weather seems to be the winner, with natural disasters and sustainability close behind. But Great.
And Megan, maybe, because I think some people are also filling in for slide 1. I'm guessing it hasn't changed too much, but just respecting those who are putting in, maybe we can pop back to that first question for a second and have
Yeah.
a look. But yeah, not surprised. It was a pretty big
Little.
variance.
And a perfectly even for short term and long term. So I think that gives us our answer. Okay. Yeah, overwhelmingly both. Fantastic. Okay. Okay, and now we've got this word cloud. So our next question is, this is a free form, so pressure's on. What types of products would be most useful on the last screen? So that last screen I showed you on the prototype with the, the 5, we picked 5, it could be more or less, with the 5 initial resources that we're suggesting you should look through. What else would be useful in your work that we could add to that? Because we have, as you saw at the beginning of the presentation, we have this fantastic committee with expertise across the board. We have a lot of, committed individuals that really want to make this useful. And so what are things that we could do kind of to add some analysis or add some, different perspectives to what is already out there, just to make this more usable in your work? We haven't discussed infographics. Okay, action, I'm seeing action-oriented, state and local representative contact information. That's an interesting idea. Action-oriented toolkits. I should also mention, we hadn't explored this at the beginning, but what we're putting together right now, we're envisioning, as 1.0. And so this is, we're going to take the next several months to really try to get this right, to make sure it's user-centered design and make sure it's provides valuable information in a very user-centered way. But it's going to be our first iteration. And so there's lots of ideas that we have been talking about and thinking about that may not be possible with this first round, but we're already thinking about for future iterations, or, for the next refresh, we could add in this or add in that. So these are fantastic ideas. So thank you all. But if they don't make it into this first round, just know that we're also kind of planning for future iterations and updates as well. Some legislative action. Oh, I really like this one. The quotes are messages of people who have been impacted, so we remember this is real life. Okay, this is wonderful. Thank you all so much. This gives us a lot to think about. Okay. I'm gonna move to, I think, one of our last questions. So we had this conversation from a few different angles, and just kind of curious on what your experiences have been in your work. We wanted to make sure that we had patient as a user, but then felt like that might be too limiting. I think right now we have the wording as an individual with health concerns, just because we were thinking, a patient that might need additional support, like especially during an extreme weather event or a disaster, if they need assistance with evacuation, or if they need, backup power, if they're on oxygen, things like that, like medical needs. But then also there's people with comorbidities or chronic illnesses that might not need that level of support, but still might have specific needs that they want to find out about and just feel more empowered. So this one I know is a very specific question. Okay. We just had a tough, when we were trying to think of, we can't have 15 different user pathways, because we thought that was too much, but then we also want them to be kind of specific enough where you get different resources depending on which one you pick. So, you know, just having individual seemed very broad. It would be really hard to figure out what would be most useful to them, but this is a kind of been an ongoing conversation. Okay. Okay, so it sounds like generally we'll probably stay away from patients. Okay. Let me see. Okay, I think this is our last question. So, what is the right level of filtering to balance the user burden? So just answering question after question, and then also having enough customization where you're seeing results that you want to see. You know, especially the one I walked you through, that's just kind of, that was our baseline level of filters or level of questions. But for some of the pathways, like for the health professional, for the community leader, we want to add more questions because there's a lot of levels that we'd like to get through, because, you know, underneath the health professional, a pediatrician is going to be looking for different resources than a respiratory therapist might be, or a cardiologist. So, you know, and on the government side or community leader side, if you meet with people generally in small groups or one-on-one, that would be very different than if you're holding town halls or you're holding, you know, press briefings. And so we're trying to figure out what the burden might be, but again, it seems like we have a clear winner. So, so we'll try to keep it at 3 to 4. I think we'll just keep that in mind. I think some of the question or some of the pathways might end up having more than 4, but I think we'll really keep this in mind and try to keep it as minimal, 3 to 4 as possible. Okay, and so that brings me to the end of my interactive presentation. Thank you all so much for participating in this. Again, if you weren't able to do this interactive piece, there is a QR code. If we bring the other slides back up, there's a QR code on that slide. I believe it's slide 10. That will take you to a survey where you can answer those same questions, or feel free to just email the climate-and-health@nas.edu email.
Thanks, Megan. And I'll also add everyone who signed on today should have either been prompted to enter their email address, or your Zoom account is just linked to your email address. So we'll send you out all this information, including a link to that deck and the QR code that comes along with it, so you make sure that you have it. So thanks to Megan, and thanks to all of our presenters. From here, we're going to go ahead and turn it over to the Q&A portion, and we're going to try, we'll see if it works. I will just call on a person who has put a question in the chat, and we'll go ahead and bring you up on the screen and invite you to share your question. And if that doesn't work, I'll just read the question, but we'll give it a shot. So with the first question, Emily Leach, if you're still with us, would you mind sharing your question?
Sure. Hi there. My name is Emily. I'm a nurse in the ICU, and I've seen a lot of single-use plastics use increased in the inpatient world, and I know that it's always been prevalent as long as I've been a nurse, but it seems even more so now. And single plastic use is, of course, connected to petroleum and carbon emissions. So I wanted to see if this resource hub, in addition to climate change and extreme weather events, would also be touching on, and now there's more data too about, you know, microplastics and nanoplastics having impacts on things like stroke and MIs. So would plastic concerns also be included in this hub as well too? And that's it for my question. Thank you.
I'll just chime in by saying this is exactly what we're looking for, Emily, is for this to be a hub that will be used by people out like you out in practice who have direct patient care, direct citizen, community member relationships. And what do you need? And so Chris, it works on the Decarbonizing the U.S. Health Sector Committee. I do too. We know that single-use plastics and the production of plastics and pharmaceuticals is a big contributor. So we are looking at this, and the fact that you raised this and said this is what you need, we are definitely going to take that to heart.
And just to add, Emily, in your written question, you asked if they would be more focused on linking climate change to health, which I think that is probably our primary focus, to show the linkages and then also showing how to best communicate it. But I think given the importance of single-use plastics, I think that could definitely fall in there.
Thanks,
Thank you.
Megan. Thanks, Teddy. And thanks, Emily, so much for the question. Up next, Amanda Barbeau, if you're with us, do you want to hop on and ask your question? Okay, so it looks like Amanda has logged off. So I will pose the question to the group. And I saw you answered it, Jonee, but I think everyone's gonna want to know this one. But are there current or upcoming opportunities to join the committee?
Yeah, that's an excellent question. I can say, and Teddy mentioned this in her opening remarks, we certainly tried to have a robust process, knowing we can't have hundreds and hundreds of people on the committee, but certainly wanted to have a good representation of diverse backgrounds, experiences, et cetera. We're currently not looking for additional committee members, but this webinar, additional opportunities for kind of engaging with us, sending an email is really, really important, and we take it quite seriously. So if there are further, if there's further feedback that you have, please do let us know. But we are not looking for additional committee members at this time.
Thanks, Jonee. Actually, you reminded me, I forgot to mention, the timeline for this. We're trying to spend really a good intentional time together over the next several months and designing it and adding the resources and figuring out these user pathways and usability for hopefully a launch in early 2025. But between now and then, we will be doing some beta testing of this prototype and more functional ones down the line. So if you are interested in being a part of that, please email that address too and let us know, because I think we want to do kind of a targeted testing of the first few times.
Thank you. Next, we'll turn it over to Erica Husser. Erica, if you're with us, do you want to pop on and ask your question? So, Erica, if you're chatting, we can't hear you, but I'm happy to ask your question. Has AI been used or considered when developing this toolkit?
I can start too. It has been used a little bit in the analysis of just the 100 or so articles and toolkits and things that we've been looking over, just to see where there's commonalities across the board and what interventions might be recommended, or actions to protect your health are being recommended over and over. And then I think definitely being considered for future iterations, because I think there are certainly ways that we can kind of set this up to be more automated and cast a wider net. But for this first one, it will likely be mostly manual. And Chris, feel free to add to that if you disagree.
Nope, nothing to add, but we'll look to Teddy and Jonee if
I'll just
you have an
add
experience in the real world to share.
No, I'll just add that NAM is being very, very intentional about the use of AI, because we recognize that AI basically just scrapes the internet for what's already out there, so that if there's communities that have traditionally been underrepresented in research studies, oftentimes we aren't seeing results pop up if we use the AI tool. So I'm really pleased that the National Academies has a deep, deep commitment to equity, and that's high on their radar. So if when AI is used, it will also be asking the questions of what is not showing up that we know has to be represented.
Next up, Jessica Long, are you with us? Jessica, if you can unmute and ask your question, we'd love to hear from you.
Yes, I'm here. So my question was, so stories are really powerful. They can be powerful motivators. Could tools be included to help capture patient or community member stories that can be shared with government policymakers, as well as other types of policymakers, such as hospital, insurance companies, and health systems policymakers?
Yeah, I'll chime in and say, yes, absolutely. We often in research think about the kind of quantitative data, but those qualitative data points and those stories, people with lived experience, again, that's a theme, are really important. So we appreciate that feedback. And certainly as we seek to roll out this tool, leveraging that and elevating that is really, really important.
Yeah, I love that idea.
Thanks so much for the question, Jessica. Up next, Wendy Purcell, if you're still with us. She's not with us? Okay, she's not with us, so I will ask Wendy's question for her. It's some thoughts, but I would love to hear Megan and then the group's perspective on if this is achievable or if it's something we'd like to do. So Wendy asks, would be great to see resources upvoted by helpful as others. It could be likes or starred. Also adding community links to volunteering projects, add links to local universities, college courses and projects, and use word situation solutions alongside actions. Any thoughts on those? Megan, I know that's it's always interesting when you have the upvote starred systems and the reliability of that, but I think it's an interesting idea.
Yeah, I actually just sent that to our designer. I think that's a great idea.
Great, thanks, Megan. Sanjay, I saw you had a couple of questions in there. Would you like to pop on and pick your favorite and ask one?
Sure. Oh, I need to figure out which question. Yeah, so I was just wondering how much private sector is involved in this engagement. And also tied to that, I think a question I asked before was how NCA 5 is going to guide this information, which is the National Climate Assessment. So how much collaboration is happening with other federal agencies, because I work at the state level. So I'll just leave it at that. I did have a third question on circularity, but probably we can drop that one.
Well, I can start with an answer and also a question back for you. But we are definitely using the NCA 5 in our, we have it in our database. We're using it to guide our recommendations and our content. We haven't at this point coordinated with any outside groups yet, but I think, perhaps that's something we can do once we get a little further along. To your question about the private sector, I guess can you elaborate a little bit more on who you mean within the private sector?
Yeah, so there is expertise relating to human-centered design or what is the best approach to putting out a website out there. So I'm just curious if some of those best practices are coming into this discussion instead of starting from scratch.
Yeah, our designer is definitely, leverages human-centered design. And then we'll be working with the development team that's contracting with the academies to do their whole website redesign. So I can't speak to, their expertise, but I can definitely take that, as we go and make sure that we are continuing to center that as we move forward.
And just the
Megan,
last part is, as I said, there are multiple initiatives also at the state level. So probably a mechanism to enable for system level thinking through this would be hugely valuable. Thanks.
Megan, I just wanted to add that the people on the communications working group have exceptional expertise in communication design, web use, et cetera. So we do have people from the private sector on that committee. But Sanjay, you have so many excellent questions. I would invite you and colleagues like you on this call to sign up to be part of our next tests of our next iteration, because this is it's people like you and the folks on this call that are exactly who we want to make sure that this this tool is beneficial to us. So consider yourself invited to the next party.
Thanks, I appreciate it.
Thanks so much, Shantae. Next up, Theo, we'd love to hear from you.
Thanks. I'm Theo Sergakis with the Ohio Hospital Association. I'm the director of their energy and sustainability program here. I know the tool can't obviously solve all the problems, but kind of wanted to know, is there going to be, there looked like there was a lot of different tracks. Is there an opportunity that's going to focus more towards, folks that are really advanced in the sustainability, energy efficiency, or facilities roles? We got a lot of, it's a growing area. A number of hospitals are bringing on energy or sustainability or both folks to help with Joint Commission accreditations and things like that. So I guess, is there an opportunity there for guides and best practices, et cetera, for sustainability? So if you're saying you have issues within your waste, here's areas you can focus on, and best practices for upcycling blue wrap or dealing with food waste, food donations, composting, those type of things that are going to help with implementing those type of projects.
I mean, I can chime in. That's an incredibly important point, and thank you for the question. I would offer that, as much as there are already, again, we're not creating new evidence with this project. So as much as there's already kind of evidence best practice available, our intent is to have it kind of seamlessly integrated into this hub. But as I'm hearing you, I don't know that we will have the kind of operational guide to do your work. I would love to be able to provide that. But as much as there's already robust evidence and material available, we're going to try and integrate that. But I don't know if Teddy or Megan, you had additional thoughts.
What I would say is all the feedback all of you are providing, none of it is wasted. So even if this site doesn't address a certain topic, this question will go back to the appropriate committees at NAM. So the decarbonization committee is working on all sorts of aspects related to this. So maybe Chris, you want to just give a little heads up about the decarbonization effort?
Yeah, happy to. Thanks, Teddy. Set me up perfectly. Yes, thanks for the question, Theo. And like Teddy said, one of the really nice things about this is it's not just this program that's this window feeding information into, it's all 5 of the pillars. So we're going to put in the chat, just in case you're unaware, we have our climate and health movement, which is under our decarbonization pillar. And over the course of the next several months, you're going to see some programs come out through them. One of which is going to be a mentor group focused on supply chain. Which isn't exactly what you were saying, Theo, but that's where you're going to start to see some of these products for people who are further along in their decarbonization or climate and health journey pop up. And so, yeah, I would add that piece. And then, like was said earlier in this presentation, it also might be in version 3.0 in this, or 1.0 if we end up changing things tremendously. That's a big if for this one, but wanted to thank you for that and just provide you with some more information.
Thanks, appreciate it.
Thank you, Theo. Aaron, will you want to pop on and ask your question? We'd love to hear from you.
Sure. So I am sorry, I have to ask it. It's a political issue. Does all this go away if there's an administration change in the executive branch of government? Is not everybody agrees that climate change is real?
Yeah, I'm happy to answer that, at least for this program and our work. The answer is no. This work will continue as it is set. If there is a change in the executive branch or isn't, you'll see at the end of this slide, we'll give a thank you to our sponsors and funders, and you can see this has its own stream of funding. The entire Grand Challenge does, and obviously there could be some changes in some of the work that is done around the country, which maybe I'll let some of the others speak to, but specifically for this program and the Grand Challenge, it will remain unchanged, and this can always be seen as a long-term health for anyone who's interested in climate and health. Did I answer your question, Aaron?
Yes, you did. Thank you very much.
Great. Thank you for asking it. And next, we'll turn over to Cheryl Holder. Hi, Cheryl.
Hi, great hub so far. I put it in the chat. It was about equity because we always encourage equitable solutions. It's been a big part of what we've talked about with NAM. And I wasn't sure how that was going to be handled on the hub, because that's what I often would love, some good evidence-based solutions and what the studies are showing on how impactful we can be when we push equity.
I'll just start out by saying, Cheryl, thank you so much, and thank you for your leadership as a national leader in this space. Equity is at the heart of what we do. Nothing matters if it only serves some Americans and not all Americans. So we really are going to be working very carefully to make sure that the resources that are offered and recommended really do get at some of these structural challenges that have some communities experiencing climate change first and worst.
Yeah, I would thank you, Cheryl. Good to see you on the webinar. I would just echo what Teddy said. It's absolutely at the forefront of this project, and making sure that people, one, are aware of the inequities that exist, and two, have the tools to be able to, and quite frankly, making sure they expect, right, that we expect people to address the inequities in response. So it's not just a nice to have, but a must have. So I think that's really important as we kind of think through the hub, even accessibility to the hub, right? Thinking through whether it's people who may have a visual impairment and need access to the hub, people who may not speak English as the primary language. I may be getting myself in trouble here with all the at least the vision for what the hub should be for me, as accessible to everyone, but also making sure the tools and solutions are equitable.
Mm-hmm. Just to add, in the limited discussions we've had so far on what to suggest as interventions, and we want to be cognizant that yes, going out and buying an air filter would be a great idea, if the air pollution is bad or if there's wildfire smoke in your area, but that's not a feasible solution for everyone. So what else, what are the things that are more accessible and able for everyone to access?
Thanks for the question, Cheryl. I'm going to go ahead and read one. It was contributed anonymously, so I'll go ahead and read it. But this is a question I'm always thinking about a lot. What reading grade level are we targeting with this program?
I think to jump in and start, we haven't necessarily gotten to that level yet, but I think it's something that is important. We've talked about it a little bit, and as we think about equity and accessibility and making sure everyone can benefit from what we're putting together, but we have not reached that stage in the design and creation yet. So if there are suggestions on what reading level we should stick to, I think we're open to that.
Thanks, Megan. I know when we originally drafted, plain language was a very specific choice of ours to not lock ourselves into anything, but to make it clear that this should be something that is understandable by almost anyone who reads it for the reasons that you shared and more. Okay, turn it over for the last question. Jonathan, I saw you had a couple of questions. I think most were answered, but maybe if you're free, you can pop on and share the last question, as I also think it's a very important one.
Yeah, thank you. Yeah, I think my question is, how much is positive messaging being used versus risks and vulnerability? Because the health co-benefits narrative will be really important, I think, to have upfront as we're talking about climate change.
Again, I think luckily we're still in the early stages, so we have opportunity to still do that. We have also had these discussions as a committee, and we don't want to be all doom and gloom and just put forward like the statistics and how overwhelming like the hazards effects are on human health, and people are just left with kind of frozen, like what do I do? There's nothing that I can do, the head in the sand effect. But I think yes, we can definitely, especially on that last screen. That's why I'm really excited everyone put in so many good ideas of things we can do, and framing it as this co-benefit for planetary and human health. I think that'll be really important too, to leave people feeling empowered and like they can take action, not like they should just kind of give up and move to the beach.
So for those of you who don't know, Dr. Jonathan Patz has been very involved in the science of climate change and climate change mitigation. And that's why we are creating this hub. Exactly why we're creating this hub is there's a whole group of people that are either new to this information, or they've been assigned to teach a course and they don't know what to teach, or they're a health professional that's getting on people's radar and they don't know where to start, and they don't necessarily know about some of these articles and resources that others have been aware of for quite some time. So I thank Jonathan for his question. We are going to really have a balanced approach. Some are further down the pike. They know all the risks, they know all the hazards. Now, what do we do about it? But some people are just starting their learning journey on what is climate change, how does climate change work, why is it a health threat? So we're going to be really working to make sure that we have resources that meet all those different levels. Again, we're not creating the resources. We are collating exceptional science-based resources that will help all people get their questions answered, or at least start them on the journey of how do you begin.
Thanks, Teddy, and thanks, Jonathan. Appreciate everyone's questions. Really, really grateful to you all. Like was shared, even if it didn't make its way to being asked, or even if the answer was that something we're discussing, the fact that it's still being brought up, I think we're going to make sure and pay the specific weight that it is required, given everyone's interested in. So thank you all. So we'll close out our session today once we get the slides up. And just say thank you to you all for joining us and taking time out of the middle of this short week, which we're always especially having a time crunch individually. So again, grateful to you all. I'm grateful to our presenters and co-chairs and everyone who contributed to this. Just a massive thank you from the National Academy of Medicine to you all. Just a little bit more of what you can expect. Like I said, we should have all of your email addresses either captured in Eventbrite or Zoom. Whatever it is, you can expect some follow-up that will provide you with more opportunities to weigh in if you wish over the next few weeks or so, but you can expect those kind of definitive parameters to be set in that email. Other than that, Teddy, Megan, Jonay, anything that I missed, any last words that you want to share? Otherwise, I'll take us home.
I'll go first, just to reiterate the thank you and grateful for all of you who joined today and gave us, a lot of really fantastic ideas. So I'm gonna go back to that Mentimeter platform and look at everything you said. And I think we have a lot of great ideas too in this Q&A and different links and suggestions of what we can do and how we can make this more powerful. You know, that this whole kind of angle on mitigation and the 3 scopes that we hadn't yet talked about, but I think that's an interesting idea, and it seems to have come up a few times. So just, yeah, thank you. You've given us a lot to think about. We are still working on this, you know, over the next several months, but if you have more suggestions or more feedback you want to share, we would ask if you could send it in the next few weeks, and then that way we can make sure we're incorporating it into our next phases. Teddy or Janae?
I would just echo the thanks. Very grateful for the feedback and the engagement. It's important that we listen. We hear from people from diverse backgrounds, and so this is just one part of that process. So grateful for the input. And I'll give the final word to Teddy.
Oh dear. I just want to say thank you to everyone attending, but this is just the very first step of the dance. We are going to need you along the way to help create this hub that is a workable model for what you need and the people in your communities need and the people that your students perhaps need. And we also will rely heavily on you of generating the buzz. So once it's released, once it's out there, start pointing people in the direction of the hub so that we start to create this cultural awareness that this is the one stop. If you have a question, you can go to and then start to be linked if you can't find other sources or you don't know where to start. So you are absolutely essential in this work. We see you as colleagues and as committee members in making this happen. So thank you all so much.
Thanks, Teddy, and thanks, Megan and Janae. Next slide, please. And just extending the last of the thanks to our gracious sponsors. Really couldn't do this work without the organizations that you see here on the screen. And with that, just going to take the opportunity to thank you all once again. Hope you enjoy the rest of your day. You'll be hearing a lot from us, and we look forward to continuing to engage with you. So thanks again.
Thank you.